Experts remain concerned we're headed for another COVID Christmas. Figures show that since August, case numbers have continued to rise. The latest reporting period revealed COVID numbers had increased in all states and territories, and we're being urged to ensure we're up to date with COVID vaccinations. The two newest vaccines will be available from December 11.
Dr Norman Swan's here to tell us how to avoid a COVID Christmas. Norman, how do we give the gift of not giving someone COVID this Christmas?
Stay outdoors, don't go indoors to stuffy environments, wear masks to protect yourself, and if you've got symptoms like a runny nose or a cough, stay away from your relatives.
God, I feel like I'm back in 2020. Just all those things.
Well, it gives you a good excuse not to go to a boring party.
Well, to be fair, I don't need much of an excuse not to go to Christmas. That's right. The vaccination thing, right, staying up to date, I don't know what up to date means exactly. After how many months or years or whatever it is do you know you're due for another jab?
Well, about 5 million Australians are under-immunised. Really, it's about, have you had a jab in 2023? And if you haven't had one, wait till the new one comes on stream and get one. But if you have had an immunisation in 2023, you don't need another one probably until 2024, unless you're at high risk or you're over 75 or you're over 65 with risk factors.
I think this is our 8th COVID wave, our possibly 3rd Christmas to be potentially ruined by COVID. I think there's a lot of vaccine fatigue out there as well. What do you say to people who are saying, another jab, really? I just don't want to do it.
Well, for those of you who've not had a jab in 2023, really? Another jab? You know, you haven't had a jab for quite a while. You know, put on your big boy pants or your big girl pants and go out and get one. I mean, a lot of people are dropping off their vaccinations, other ones that they should be getting as well. So there is vaccination fatigue, you're absolutely right. But this is, you know, if you look at emergency department presentations, 35% of people coming with COVID are admitted. This is not a mild virus, and the death rates are going back up again.
I've got my big boy pants ready to go. I'm in, I'm excited. It feels like a new iPhone's dropping. What's different with this new vaccine?
Well, it's just an up-to-date vaccine. It's actually only got one version of the virus in it. The last one had 2 versions. This one's got the latest version, which is XBB, which in fact is the subvariant of the vaccine. It's more like a car, a Holden really, but it's the version of the vaccine that's the virus that's mostly around in Australia at the moment.
So not a new phone or picture, not a new camera, nothing exciting like that?
Well, unless you're an anti-vaxxer and you think you're being injected with something electronic, no.
Oh, wow, that's a way to sell it.
Yeah.
Well, my wife's got a lot of boring Christmas parties coming up that I don't want to go to. Should we lock down just to be safe?
I think you should just pretend to sneeze a lot.
Yeah.
Either works.
Could be going to a party.
Norman, thanks for the chat.
Welcome.